Welcome to another episode from the Veterinary Medicine Digest. Today we're diving deep into a topic that's crucial for our canine companions, humeral intracondylar fissures, or HIFs. You might also know them as incomplete ossification of the humeral condyle, or IOHC. Imagine a dog, typically a spaniel, experiencing persistent lameness or even a sudden fracture in their elbow without a major trauma. This is often due to HIF, which is essentially a weakness or crack within the humeral bone of the elbow. If left untreated, these fissures can lead to full humeral condylar fractures. In fact, studies have shown that 18% of incidentally identified HIFs in spaniels can progress to a fracture, and another 6% may become lame and require surgery. The standard treatment for symptomatic HRF, or even an incidental one, often involves placing a transcondylar screw across the elbow joint to stabilize it and prevent further complications. However, this procedure isn't without its challenges, with reported complication rates ranging significantly from 15% to as high as 19%. The most common issues seen are seromas, which are fluid-filled swellings, and surgical site infections. Now here's the clinical dilemma that comes into play. For years, veterinary surgeons have debated the best direction to insert these screws. Should it be from the medial or the inner side to the lateral side, or vice versa? Previous studies have offered conflicting results, or were not considered high-level evidence, leaving surgeons to often rely on personal preferences. This lack of clear evidence-based guidelines is exactly what this randomized clinical trial aimed to address. The goal was to provide the highest level of evidence to definitively determine if the screw placement direction impacts post-operative complications in dogs with HIFs. So you might be asking, what did this significant study involve? Well, the researchers enrolled 52 client-owned dogs, totaling 73 elbows, for this randomized clinical trial. Screw placement was randomly assigned to either a medial-to-lateral or lateral-to-medial approach. The study meticulously followed consort guidelines for reporting randomized clinical trials to ensure robust methodology. The sample population largely consisted of spaniels, including Springer and Cocker spaniels, along with some crossbreeds. HIFs were diagnosed using CT, or computed tomography scans. And as far as the results, they're quite illuminating. The study found a significantly greater proportion of post-operative complications when transcondylar screws were placed from a lateral to medial direction. So let's break down the numbers. In the medial to lateral approach, only 7 out of the 36 cases, or 19%, experienced a complication. This is in stark contrast to the lateral to medial approach group, which saw complications in 23 out of 37 cases, or a substantial 62%. And again, that's versus the 19% in the medial to lateral approach. This means that the lateral approach carried a 3.2 times greater risk of post-operative complications compared to the medial approach. To put this another way, placing 2.3 screws from medial to lateral could prevent one additional post-operative complication that would likely occur from a lateral to medial approach. The majority of these complications were minor, specifically seromas in 13 cases, and surgical site infections in 16 cases, which often resolves with no treatment or a course of antibiotics, respectively. Importantly, there was no statistical difference in major complications requiring further surgery, like implant failure between the two groups. Beyond the screw direction, the study also investigated the role of implant characteristics. They found that implants with a lower area moment of inertia, or AMI, when normalized to the dog's body weight, were more likely to lead to major complications. This suggests that relatively small diameter implants had an increased risk of serious issues. The researchers suggest aiming for an implant with an AMI body weight ratio greater than 0.3 as a useful guide for implant selection, as no implant failures were observed in cases meeting this criteria. This recommendation should also be considered alongside advice to use implants that are less than 41% of the narrowest part of the humeral condyle to prevent other issues like medial epicondylar fissure fractures. Another interesting finding from this trial touched upon antibiotic use and concurrent conditions. Despite the relatively high surgical site infection rate, none of these cases in this trial received prophylactic postoperative antibiotics. This is significant because previous studies often utilized postoperative antibiotics due to high infection rates. The authors speculate that reducing the heat generated during drilling and lowering the incidence of seromas by choosing the medial approach also contribute to reducing infections. Furthermore, nearly half of the dogs in the study had concurrent medial coronoid process disease, or MCPD. However, an impressive 97% of owners reported an improvement in lameness after just the transcondylar screw placement. This indicates that, for most cases, addressing the HIF alone is sufficient, and treatment for MCPD can be reserved for a small percentage of dogs that remain persistently lame. In conclusion, this randomized clinical trial offers clear, strong evidence that placing transcondylar screws from medial to lateral significantly reduces the rate of postoperative complications. It also emphasizes the importance of selecting implants with an appropriate area moment of inertia relative to the dog's body weight to minimize the risk of major complications. These findings provide crucial guidance for veterinary surgeons, moving away from personal preference towards evidence-based practices for treating canine HIFs. That's all for today. Thank you for listening to the Veterinary Medicine Digest. The title for the reference paper is in the video description, along with some questions that go along with the article. And as always, keep your minds inspired, hearts light, and tails wagging.